Hi, Rod Rohrich, Rohrich Knows Podcast, and YouTube. Welcome back. Again, we're helping you to be a better you. And today we're talking about innovative technology and techniques that help you look better non-surgically. And great to have David Weir, my nurse practitioner, with me from Dallas Plastic Surgery Institute. So David, welcome.
Yeah, thank you for having me.
So everybody talks about how they can look better, feel better non-surgically. And so many times it doesn't work. You know, it's kind of like those late night ads you watch and you go, you're doing neck exercises, have your neck fat go away. It doesn't work. But we're going to tell you about real science and real technology that actually has an incredible improvement in improving facial wrinkling. And it's called dermal microporing. Now, isn't that a mouthful? What is dermal microporing? And before I talked about it with you, David, is that this is actually some innovative technology that actually I have worked with this company in Boston for almost 8 years, 7-8 years, and they have been very innovative and persistent in giving you. Finally had a device that actually helps to tighten skin with minimal downtime and remove or refine wrinkles. And Cytrellis is a great little company, and actually they're partially funding this podcast. So, but obviously we're very independent, and David, of course, has done 15 patients very recently, and he's going to share with us his knowledge and what he's learned about it, what works and doesn't work. So tell us, David, what is dermal microporing? It sounds like it's going to be a hot item in Instagram, and maybe we can get Kim Kardashian to use it.
Hey, I'll text her.
I'll have to ask Dr. Gavami.
Okay. I have to laugh when you're talking about the Instagram ads of the crazy things people buy to do stuff. And I had a flashback. I had patients forwarding me this Instagram ad to get a stronger jaw line, and it was like a ball that you chew on. And they're like, does this work? I promise you, I had like at least 5 patients ask me. I was like, that looks terrible. Don't do that.
Was it bubble gum?
No, it was like a ball. It was like a dog chew toy that you slide down over and over again. And I'm sure people in the audience have seen that ad before. Yeah. So
I know if you stay up late enough.
If you stay up late enough.
Yep.
We're talking about Cytrellis. The procedure is called Ellacor. It's a micro coring device that actually cores out or punches out tiny little sections of skin. So
less than a millimeter, right?
Yeah, it's less than half a millimeter.
Right,
so
it's amazing.
It is amazing, and I heard about it probably 4 or 5 years ago, and I think it was at Cosmetic Boot Camp that I heard about it. And I've been beating down Cytrellis for years now to get this device. So we're privileged. I mean, we're one of 2 people in Texas that have it. There's less than 20 of these devices across the country, and that's just because Cytrellis really trusts us and trusts our knowledge and expertise in the field to play with their device post FDA approval and give them some honest feedback of what it can do, what it can't do, and how we can really push the limits with this new innovative technology.
And I do happen to know, of course, a couple of my good friends, Jay Austin, who's at Harvard Mass General, and he's one of the developers. And it's an innovative technology. We'll show you how it works. Yeah.
So this is a device handpiece right here. This handpiece hooks up to a much larger machine that's at my office because I didn't want to try to get it in my car. But it has 3 tiny needles and kind of like a sewing machine effect. And we'll go in and core out in a pattern that we select based on the patient's goals and what the patient can handle. We can remove up to 8% of the surface area of skin at one treatment. So the evolution of skin tightening. Wow, that's a long story. I'll talk technology-wise. So for the longest time, we've tried to tighten skin by using neocollagenesis, creating new collagen, right? So that's where we have like our thermage and that tightens the skin from the inside out using sono. Then we started trying to do it with lasers. Fractionated laser. We burn tiny little holes in the skin heals up, gives moderate, slight tightening of the skin. Right. Then we came out with radiofrequency. So radiofrequency really pushed the envelope because with microneedling,
with Morpheus,
with Morpheus, you can go underneath the skin itself and cause the tightening from the inside out. Where before we were really limited because if we put too much energy into the superficial surfaces or the top layers of skin, we would burn somebody.
Right.
And no one wants to go in for tightening skin and get a 3rd-degree burn. That'd be terrible. So we're limited. And then it came radiofrequency microneedling. it does tighten, but it doesn't remove skin. And you know, as a plastic surgeon, you can only tighten so much before you have to excise or cut out skin.
Exactly.
That's
So this
why
is
women
kind
have
of a
facelifts.
micro ability to tighten, but also removing small amounts of skin.
Small amounts of skin, yeah. So again, you can
non-surgically.
Non-surgically. This is done in the office, and it's nothing to be scared of because I do some injections in the treatment area. So once the injections happen, you don't feel anything. Okay?
Right. And you inject this area, the jawline.
Typically from the cheekbone down to the upper part of the neck is what the FDA approval is for. We've been pushing the envelope, and that's why they gave us the device. So I am treating necks as well and getting some really favorable results. But I think for you to see what it looks like, we're going to go to a quick little animation that will show you what the device does.
And how it does, and how it works. And
and how it works.
With the small microporing, and really, just so people understand, microporing, it's not like microneedling. What you're doing is this actually takes small amounts of skin out like a Singer sewing machine, and it actually almost sounds like it too.
It does, yeah.
And then you get a little petechial bleeding, but it's actually, and then when you get those removal of that skin, then actually, normally what happens, it's actually very smart. Then the skin contracts, and then with that, you get tightening, but also the wrinkle reduction. So it's actually brilliant. Because there's been other devices where it's a bigger amount, like it's a millimeter or two, and then you get scarring. So you got, it's between scarring and recovery and result. And I think Ellacor, with Cytrellis has actually really come to a really finesse endpoint there where it really works. In fact, they just have their first abstract that's going to be published in PRS Global Open on this called dermal microporing for treatment of moderate to severe facial wrinkles. It's kind of their pivotal study. So, kudos to them. So David, okay, so you've had 15 patients, and tell us about that. How did they do?
Yeah, they did excellent. The healing time is, I found, very variable. I have one of my very first patients that I treated had a vitamin K deficiency. So she had a little bit more of an extensive healing time because there was a lot of bleeding and bruising associated with the procedure.
You need vitamin K.
You need vitamin K to stop bleeding.
Bleeding.
And I didn't, and she didn't list it in her medical history either. So I was like, did you drink?
Was that the patient we did together?
Yeah, the one we did together.
She did have a little bruising.
Yeah, and I was like, did you take fish oil or aspirin? She's like, no. And then I saw her for a subsequent treatment, and I was like, out of all the patients that I've done, you bleed the most. And I said, are you sure you're not drinking before you come in here? And she said, oh yeah, I have a vitamin K deficiency. I'm like, well, you didn't put that in your health history.
Yeah.
But I mean, she recovered. It took her about 5 to 7 days to completely recover.
Fabulous result.
But fabulous results. And I think they'll cut to a picture of her before and after for her first treatment. Now she's since come in for a subsequent treatment.
So tell me, okay, if I'm the patient, so what do you tell them? How long does it take? The discomfort? How many treatments? And when do you see the final?
Yeah. So as far as how long does it take, I set the appointments for 2 hours. And that's just because I like some wiggle room to make sure that I can be very thorough. The first half of it is all numbing. The procedure itself maybe takes 30 minutes to do the lower face and the upper part of the neck. How long does it take to heal? Very variable to the patient's lifestyle. And that's just because like my first patient, who's an active bleeder, took longer to heal. I had a more mature patient in her 60s that came in that I did her treatment. And by 48 hours later, you couldn't even notice that she had anything done. Now, she walks 5 to 8 miles a day, and she's vegan. So, I mean,
really,
yeah. So
thin skin, thick skin,
thin skin.
Really,
I was telling her it would take about 7 days, and she sent me pictures 2 days afterwards, and I hardly looked like I did anything. Now, as far as the number of treatments, again, it's variable. If I could predict anything that we do and how many treatments you need, I would probably play the lottery more often. Okay, so I don't know. I don't know how many treatments now. In the study, they did 3.
Right.
And at 3 treatments for moderate to severe wrinkling, there was statistically proven results as far as reducing the amount of
how far
wrinkles.
apart?
Typically about 4 weeks apart.
Right.
Okay, we want give the skin some time to heal.
Yeah.
Now, there's no harm in waiting a little bit longer.
Right.
I wouldn't recommend going in shorter intervals, though.
Right, because wound healing is 42 to 60 days, and that makes sense.
Yeah, and one of the things I tell patients is I say, I don't know. Like we've had this discussion. I don't sell packages because I don't know. Like I don't know if you need 3 treatments. Honestly, I don't. And I found in anything that I do, some patients just get better results faster, and some patients require more treatment. So I say, let's do 1, wait 4 to 6 weeks, come back in, look at your photos, see how much improvement that we've gained from the treatment. And if we think, wow, that looks good, but we can do better, then we'll do another treatment. And I approach it every single time. So I have some patients in my head that I think will probably need 4 or 5 treatments.
And so tell us, just break that down on 15.
Yeah.
Break it down on, so which ones do you think will need a few more treatments, which ones won't, and who's the ideal candidate?
Well, just in anything that we do in aesthetics, typically younger, healthier candidates respond better to everything.
Right.
Okay.
So I would do fine with that.
100%. Yeah. 1 treatment and done. It'd be perfect. But I find that in younger, healthier patients. Now, we have to align the number of treatments with your expectation.
Right.
Okay. Because I've had patients come in and I think they would get good improvement with it.
But they want surgery.
They want a surgical result. They want, 70, 80% improvement. I'm like, well, you have to go see Dr. Rohrich for that because I can't get close to it with something non-invasive.
Right.
Know? And it depends on their skin laxity. So I think this is ideal for women. I've learned that, women between 45 to 55 is like pedal to the metal aging. That's the fastest part in their life that they age. And that's that perimenopausal hormonal shifting, all that fun stuff. All the sun damage from the 20s is starting to show at that time. And that's why, average facelift for a woman is what, like 55-ish?
50, 55, and that's the best time to do it.
Yeah.
Best result, lasts longer, looks better.
Yeah, so I find that women that are in that kind of age range do really well with it, just because they're just now experiencing that skin laxity. So we're just kind of tightening up a little bit. The other patient that I see this fitting really well in is those patients that have had a facelift. And, 5-10 years down the road, they're starting to just get a little bit of skin laxity, and they just want to kind of tune things up. That's an excellent patient for it. But if you come in and you're sitting in my office and I'm looking at you and you need a face and neck lift, I'm going to tell you, you need a face or neck lift.
Exactly.
Like I can't, your expectations do not align with what I can do non-invasively.
Right, and plus you want a happy patient with a good outcome based upon what you tell them to expect.
Oh, 100%.
Yeah. And we'll show you some examples, right?
Yeah. So they'll cut to some examples before and afters of what the study looks like in the publication, what was published in the study, as well as some of my own before and afters. So you can see what to expect from a 1 to 2 to 3 treatments.
So David, what do you tell your patients? Okay, you do them 2-3 times, and then, so what is the downside? I mean, in your experience, the average recovery is 3 to 5 days?
3 to 5 days is average, yeah. Because there's some areas of the face that have a higher propensity to bruise. That's going to be where some of the, bigger arteries are, transverse facial artery, mental artery, stuff like that you might get a bruise. And the bruising journey is independent to the patient. Everyone bruises and heals differently. Now, as far as the little cores that we create, they're closed by about day 3. So for the first 3 days, no makeup, no nothing. We'll get you a cleanser that I want you to use, a little bit of water, some skincare products that are safe to use on open wounds. And then after day 3, you can really return to whatever you want. You can wear makeup, you could do your normal skincare routine, whatever. But those first 3 days, I think, are the most important and probably the biggest part of the recovery. Now, in the realm of aesthetics, if you don't care if someone says, what did you have done? You can have it done and go to work the next day, but you will have tiny little dots, and you'll see it in those pictures. Right. All these tiny little microcores that are evident.
Right.
If you don't want anybody to know, then I would probably say have it done on a Thursday or Friday, and then by Monday you can wear makeup and go back to the office.
Mm-hmm. Good. And then how about males?
I've treated a couple males.
And is it
so far really good?
Males by and large aren't as good at patients, right?
Yeah,
we're not.
Yeah, no, they're typically
includes us,
I think everyone in the audiences might have heard the term man flu. Like, men don't really do well with procedures or sickness or anything like that. I've had a couple guys that I've done it on, and again, once you do the numbing solution, they don't feel the treatment. Everyone likens it to like a pretty good sunburn for about 2 days.
Really?
Yeah, just so the skin's a little irritated and tight feeling. But I haven't had a single patient that's called me and said, hey, can I take Tylenol or anything like that?
Really?
Yeah, so there's no post-treatment pain control whatsoever.
Yeah, well, that's remarkable, because when you look at it, you go, oh, that may hurt. But again, you use numbing.
Yeah.
The procedure itself, you said, takes about an hour.
Well, the treatment time is about 30 minutes,
30
but
minutes.
you're in my office for about 90 minutes to 2 hours from start to finish.
Right, yeah, because you have to do the numbing and all those things.
Yeah, and you get photos and sign consents, and it's a process.
Yeah. So tell me, and I know you've done 15 patients, so what about the future? I know in the study how they were followed for up to a year?
Up to a year, yeah.
And then, so what, they look really good in the study. I must say it's remarkable.
Yeah.
As a surgeon to say that, I'm going, that's pretty unbelievable.
Yeah. I think the ultimate goal for me is to give surgery results without having surgery. It's to put you out of a job.
Put me out of a business. I think.
But that's the ultimate goal in everything that we do. It's to make it the least invasive with the maximum result.
Right. And I think, we'd love to say that, eventually facialists won't have to be needed, because if you can tighten the skin, remove the wrinkles, and fill it, with your own fat or fillers, then you've got it.
Yeah.
And, I think it'd be great.
Yeah,
Sign me up.
Yeah, the results are, they speak for themselves. It's a tremendous new device, a new innovative technology. It's tightening skin like we've never done before.
Well, okay, what about the complications? Have you had some potential downside and complications?
I have not, but I'm also well educated and I understand the anatomy of what's happening underneath the skin. I would not go to somebody who is not well-breast or at least well-read in
facial nerve anatomy,
facial artery anatomy. Now, the two biggest complications that can happen would be scarring. Right. Obviously, if someone naturally is a scar, or they have a history of keloid scarring,
but it was not even an issue.
That could be a potential issue that you have to, as a clinician, you have to be able to discern. The other thing is, nerve palsy. If you go too deep in the wrong area and you hit a nerve, you can get some neuropraxia, which neuropraxia, for anybody that's not in medicine, is basically just an injury of the nerve, so you can get some numbness or tingling or even weakness in that area of the face. Now, in the study, anybody that did get neuropraxia, it did resolve,
right?
But it's just it could be a side effect. So you have to, really know your provider's credentials and their education, and make sure that they understand the underlying anatomy of what's happening, so you can avoid those potential complications.
Right. So you've been doing some on-label on the upper face and lower face, and now tell us about your off-label use in the neck.
Yeah. So I've gotten some, and you'll see one of my own before and afters that we did the lower face, upper neck, and it was tremendous as far as tightening at the upper neck.
In the neck? So you went on the jawline?
Yeah, so I went below the jawline. I try to stay away from the actual jaw bone per se,
right?
Just because your marginal mandibular nerve runs around there and you don't want to hit that guy. So I try to stay above it or below it. But you can get some significant tightening in the neck. And it's good for someone who has up to moderate neck laxity. If they have severe neck laxity, if I look at them you need a facelift, I'm going to send them to you, because I can't do it. I'm not going to make you waste your money on something that's not going to give you a great result. Right,
and I think that's the key. Go to a provider that's going to be honest with you and say, we can get it improved 20, 30, 50%, and then make it happen. So where do you think this technology is heading next? I think it's exciting new technology. It looks like a game changer.
Yeah, it is a game changer. And, again, we're being able to excise skin or take skin out without causing scarring is
amazing.
Key. Now, I think we will, the future of it and things that I'm starting to tinker with already is going to be scar revision. This is going to be on scarring for maybe like a tummy tuck or an arm lift or a thigh lift or something like that.
You mean for truly hypertrophic scars?
For truly hypertrophic scars, because basically scarring, as we know, is just disorganized collagen.
Right.
So if we can go in and break down and cause an inflammatory response in that disorganized collagen and remove some of it at the same time, theoretically, your body should replace it with non-disorganized collagen, okay?
Yeah.
To improve the appearance of the scar. Now, will you be able to get rid of it? No. But we can always make it look better.
Yeah.
And I think that's one envelope that we'll be pushing in our office is playing with scars. Maybe not even surgery scars, atrophic acne scars or, cystic acne scars or even non-traumatic scarring from like a cut or something like that.
Right. Fooling Mother Nature to actually help homogenize the skin. So the interface. No, that's a great idea. And I think, that's the great thing with technology is that it always helps you leap to the next echelon of undiscovered or things that are not solved problems. And I think that's really important. So I think the take-home message here is, know before you go. When you're looking for new and innovative technology, you got to leapfrog through Instagram and TikTok and find a practitioner that truly has done it a lot, that you trust, that'll be honest, that will actually tell you what it can do and more importantly, what it can't do. And I think there's no such thing as a miracle, okay? Because, if it sounds too good to be true, it's probably not. And yet you'll see it on Instagram. So know before you go. Give us your comments and questions and see if you have any questions for David or myself about this amazing new technology by Cytrellis, call us and we'll certainly keep you updated on all of these new innovations in non-surgical wrinkle removal, reduction, and skin tightening. And thanks again for joining us on Rohrich Knows and helping you become a more educated you in seeking out how you can help yourself in the anti-aging process. Thank you again, David.
Perfect. Thank you.
Yeah.